A small animal neurology exam involves evaluation of the cranial nerve reflexes. I have my patient Toby here with me today to demonstrate, so let's get started. The pupillary light reflex evaluates cranial nerves 2 and 3. Take a pin light and shine it into the right eye. This stimulates the optic nerve. Watch for the direct response of the right eye pupil constriction. Now, quickly move your pin light to the other eye to check that it has also constricted for the indirect response. Constriction is elicited by the parasympathetic response of the oculomotor nerve, which causes constriction of the pupil. Remember, PLR does not assess conscious vision. PLR can function in a blind eye. Therefore, in order to assess conscious vision, one must use a maze or navigate the novel environment or do the menace response, which I will demonstrate with Toby next. For optimal results, use a strong pin light instead of a cell phone. Also, perform this in a dim to darkly lit room. You don't want the response to already be elicited in a very bright room. Let's watch this again. Notice that when I move over to Toby's left eye, it is already constricted. This is the indirect response. The palpebral reflex evaluates cranial nerves 5 and 7. Tap either the lateral or medial canthus of each eye. The dog should blink in response. Remember, the trigeminal nerve, cranial nerve 5, is sensory to the face, while the facial nerve, cranial nerve 7, controls motor function to the face. It is the orbicularis oculi muscle that constricts for blinking. There is also something called the corneal reflex, which evaluates cranial nerves 5 and 7. However, this involves actually touching the dog's eye. So, you'll be a better friend to your canine patient if you stick with the palpebral reflex to evaluate these two nerves. Here, I chose to evaluate Toby's medial canthus on each eye. This specifically targets the ophthalmic branch of the trigeminal nerve. If you were to choose to elicit the response on the lateral canthus, this would elicit a response from the maxillary branch of the trigeminal nerve. The menace response evaluates cranial nerves 2 and 7. Notice this is called a response, not a reflex. Make a menacing gesture towards the eye and expect the dog to blink in response. Because the forebrain is involved, this evaluates conscious vision. Be careful not to cause too much airflow with your hand gestures. The airflow could actually elicit a corneal response with the air hitting the eye. Notice the controlled hand motions. The trigeminofacial reflex evaluates the trigeminal nerve, nerve 5, and the facial nerve, nerve 7. These are the same nerves that we evaluated for the palpebral reflex. Although again we are looking for the blink response, remember this is not the menace response. Therefore, this reflex does not evaluate conscious vision. Be mindful to keep your finger close to the whiskers. You wouldn't want to put your hand too far away and bring it back in because this could look like the menace response. The oculocephalic reflex evaluates 4 cranial nerves: cranial nerve 8 and cranial nerves 3, 4, and 6. To elicit this reflex, slowly move the head to the right, looking for the clicking motion of the eyes. Then slowly move it to the right. Remember to move slowly. Notice the quick clicking. Lastly, pull the head up and watch for the quick click of the eyes. The final reflex we will visit today, the gag or swallow reflex, evaluates cranial nerves 9 and 10 simultaneously. Here I am stimulating the response in a direct way by putting my finger down the dog's throat. However, this can also be performed in an indirect manner. Simply massage the dog's throat with your fingers on either side of the trachea. You should definitely consider doing the indirect method if you are suspicious that a dog could have a zoonotic disease such as rabies, or if you're dealing with an aggressive patient. Thank you for joining Toby and I for his cranial nerve reflex evaluation as part of his neurological exam.